Okay. Hello. So, at the outset, I thank the MEEOM organizing committee for giving me this opportunity to present in this session. It's always an honor to be here and present amongst you all. So the global burden of OST, and as has just been discussed, that ocular surface comprises the conjunctiva, cornea, lacrimal gland, and the related eyelid structures. My previous speakers have given a detail on that, so I'll not go into that. But what I would like to say is that OST is not just a disease, but a spectrum of diseases. And it encompasses a large range of disorders impacting its normal structure and function, leading to symptomatic discomfort, visual disturbances, and tear film instability. If you look at the risk factors are demographic in terms of advanced age, females more being affected, and ethnicity. In systemic factors, it can be systemic inflammatory problems, the hormonal regulation, sometimes also the mental health conditions, and other medications. The ocular risk factors, contact lens, which is very, very common with ophthalmic surgeries happening done, the blepharitis of the lid, that becomes very, very common. And some modifiable lifestyles which are becoming very common and very important these days, like digital screen use, the environmental factors, sleep disorders, and even diet. Like everything is now coming back, it's all about gut. The features can be in form of chronic inflammation, the meibomian gland dysfunction, tear film deficiency, and the most refractory form of restricted ocular movements. The mildest form of ocular surface disease is SPKs, and it can be because of lifestyle problems of computer vision syndrome, the meibomian gland dysfunction, or post-adenoviral conjunctivitis as well. So let me take you to this patient, 40-year-old female who had history of fingernail trauma and came to us. And we were more bothered looking at this eye, thinking, okay, this is a trauma which has come and now it's an epithelial defect which we have to heal. But when we went to the other eye, it was this problem. So there were SPKs in the other eye as well. And on further prodding, we found and got some investigations. It was a case of rheumatoid arthritis. So sometimes it's not that obvious. And we ophthalmologists at times are able to identify it before the rheumatologist. Sometimes it's very obvious, as you can see in this case, bilateral involvement with the bony problems there. And it's an obvious case of rheumatoid arthritis. Other bilateral involvement can be because of other systemic conditions of SLE and Wegener's. So if you look at the spectrum and global, I would say the burden, the estimated prevalence is 5 to 50%, and there's wide range due to diagnostic criteria and population studied. The higher incidence in Asian populations and older adults, and female to male ratio, as we just said, is approximately double females than males. I'll take you now to another spectrum of ocular surface disease, which has not been discussed till now. This patient presented to us with a 1-month history of pain and redness and was on this array of medications, antifungals, antibiotics, antivirals, whatever possible was there for her. And was referred to me for keratoplasty, in fact. And what I felt, it was more like a thinned out, and I was not sure it's a plaque or a desmetocele which is there. But as you go in for that, rather than taking up for keratoplasty, when nothing grew and nothing came up on the scrapes, I immediately on that day stopped all medications and just gave a broad spectrum antibiotic. And to surprise, it was like a drug holiday which was given, and to my surprise, everything healed. So what we were dealing here was not actually the problem because of an etiology, but because of the medicines. Another patient referred for the keratoplasty on cocktail medications, and that was the option which was given to the patient. But as a routine, I always have this habit of scraping and getting things done. What it grew was Corynebacterium, which I knew was like a commensal in the eye. And the only thing which I did was stopped all medications and just gave a broad spectrum antibiotic, which was preservative free, and the patient resolved. This was a very interesting patient who presented for fungal keratitis at our hospital, started on antifungals, and at the course of a disease, when the patient was on treatment, it did not resolve. So finally, it was thought, okay, let's go in for a therapeutic keratoplasty for this patient. And when this patient was planned around 4 days later, on table, it looked like, oh, it's pretty consolidated. Why? Then what has happened that suddenly the patient healed? And somewhere there was some problem with the communication, and he stopped all topical medications. And just on that, he started to heal. And, in the course of disease, just on medical management, the patient did respond. So this is another, I would say, a forte of the ocular surface disease, wherein the worsening of infiltrates or the corneal condition is due to the toxicity of the medications. So the toxic lineup, it can be because of preservatives like BAK, and obviously anti-glaucoma medications have a havoc on the cornea, and prolonged antiviral therapies, sometimes antimetabolites and anesthetics and steroids and decongestants can also have a very bad effect on the ocular surface. This was one of our published case of the drug toxicity, which led to the problems in the ocular surface, and one of the patient on PHMB for acanthamoeba keratitis having these lid problems which came up, and that's something we are observing very closely in when the patient is of acanthamoeba keratitis. Another cause of OSD is allergy, and conjunctivitis. Allergic conjunctivitis is 15 to 40% of global population, and adolescents up to 20.7. And if you look at, there is a cascade wherein it says there is a overlap between the dry eye disease and allergic conjunctivitis, and 47% approximately of allergic conjunctivitis have dry eye, and 18% of dry eye have allergic conjunctivitis. So conjunctivitis roughly affects 15 to 40% of these people and 20% of the population in the globally. So spectrum of allergies starts from just small papillae and follicles and to the corneal condition, and sometimes to the blinding LSCD on the ocular surface, which happens. And this was one of the cases wherein the patient had a VKC and developed severe ocular surface disease. And we know long-standing of it can lead to LSCD because of loss of palisade of Vogts and the Bowman membrane damage, and it may cause an associated corneal ectasia as well. This was one of the papers wherein it very beautifully elicits the pathogenesis of LSCD in long-standing BKC. And this is one of the series. I have Dr. Sangwan here. I've borrowed this from him and thank him for that. And this is severe VKC, which actually led to limbal stem cell deficiency, leading to a slit, and later on keratoplasty was done for this patient. So refractory cause of severe OSD is VKC, and in a large tertiary center, we went through this literature and found that it was clinically seen in about 1.2% of VKC leads to LSCD. And most affected eyes were from young males with long disease duration, and often showed advanced LSCD at a relatively young age only. So in the second decade of life, they may need an intervention. So this was one of the, it was a retrospective analysis which was done at our hospital over a period of 4 years, wherein 54% of cases of VKC were found to be of purely palpebral types. And it was easily missed because if the lid eversion is not done, it will not show up. And limbal involvement leads to higher chances of development of LSCD in the course of disease. That was one of, this is the unpublished data, and we are going ahead to publish it and understand more about VKC. Another missed OSD, which leads to severe OSD, is OCP. And if you look at it, it's a very underdiagnosed condition, and that's something we've come up, and they're usually being treated more as chronic conjunctivitis, and they come off and on with an off and on trajectory. And the thing with this disease is that it's a very relapsing and remitting course which comes up. 1.3 to 2 per million are affected, with the mean age of 60 to 65, and females more prone to this. So any female coming with a chronic conjunctivitis, we should definitely go and look at the lids more and find out if they are having any similar fronds or anything which suggests OCP in them, even the early OCP. The most severe form of OSD we know is SJS or 10, and it's a battle beyond skin. Acute ocular involvement is roughly 50 to 80% of hospitalized SJS or 10 patients. The ocular involvement is definitely seen there. Lid margin keratinization with fibrotic bonds is as seen in one figure, and this is the post-MMG of the same patient wherein we are able to take care of the lids. So the incidence and prevalence, like the global burden, if we come up, it is rare, but it is in 1 to 6 per million persons per year. And in our country, it is more than that. And I looked at some of the reports of the US and the UK. Again, they are saying that it is becoming it is becoming commoner than it used to be before. And around 86,500 new cases globally per year is something that this report suggests. From India, if you look at the high rates of severe visual impairment and blindness was seen in this tertiary care studies, and studies also found that 60% of the patients with chronic SJS, they usually end up with low vision or blindness. So in a nutshell, when I've been to different forms where OSD can occur, the OSD encompasses a spectrum from mild dry eye to severe cicatrizing disorders. The dry eye disease is the most common OSD, affecting 5 to 50% of the global population, and a pooled prevalence of around 11 to 30%. The ocular allergy affects 15 to 40% of the population, and 30 to 40% of these may have an overlapping dry eye features as well. And cicatrizing OSD in the form of SJS, OCP, or 10, it is a rare but vision-threatening and estimated to have an incidence of 1 to 6 per million per year in most populations. This was one of the studies which at LVPI, and I would give credit to them, and it was in one of their reports which came up when we're looking at all the corneal pathologies which actually presented in their clinics, and found that ocular surface disorders are becoming very high when it comes to corneal referrals or corneal OPD which is seen. And in terms of surgery also, the ocular surface surgeries are far uptaking the ectasia, the other endothelial disorders, and we need to stress and I would say put a little more focus on this. At our hospital in Delhi, when we did this study, we found that dry eye and VKC dominate the ocular surface disease spectrum, and chemical injuries and SGS are now showing significant annual incidence, which was less as it used to be. But this is from 21 to 26 data. And our hospital, not just at Delhi, but we have our secondary centers around states which are at rural areas. And when we compared the scenario from the main Delhi, which is more like a tertiary center, to the other secondary centers, we found that dry eye and VKC still remain leading ocular surface across centers, and secondary centers show a progressive rise now in chemical injury and allergic diseases, which used to be less in previous years. But the base hospital continues to handle complex and referral heavy loads, which is bound to be there. So the trend here reflects strengthened outreach and early disease recognition across network of Shroff Charity Eye Hospital. Now, going up, what are the problems which can happen? The workplace and productivity loss. We know that higher rates of anxiety, depression, and sleep disturbances in moderate to severe OSD cohorts is something which has been found in many studies. And indirect cost from productivity often leads to excess direct medical cost for most of the patients. The problem here which is coming is more on the digital era exposure, like screens, air conditions, which aggravate symptoms in working age on these adults who are actually out in the office. Economic burden has been studied in many countries, and I have this report which says that total burden is more than 55.4 billion for the United States economy, and direct medical bills are also very, very high. These are the three studies in different countries which show definitely we need to really focus on the day which we have designated like today, just discussing on ocular surface diseases. The challenges are diverse in diverse groups, where we have to understand, well, we know and we stress on all others, the screen intensive jobs. Somewhere the awareness and education needs to be there, because the rest definitely come to the doctors, the others don't even come to them. So the recommendations to the doctors regarding preservative medications, this came up from a group of surgeons who came up with a big recommendation expert group, where they said the unavailable or unaffordable, choose stabilized oxochloroquine complex or sodium perboate rather than BAK. And educate the patients on chronic preservative toxicity and encourage them to seek safer options. The challenges are there in health system, wherein the underdiagnosis and inconsistent diagnostic criteria is there, and limited availability and affordability of advanced treatments at most of the centers doesn't allow a lot of these severe cases to be treated. I would just end by just sharing this snippet of this patient of a doctor who presented to us for a long time during the COVID era. And I co-managed with Dr. Sangwan this case, presented to us as a fungal case. I'll just take you to the picture, and this is how they presented. A known case of leukemia, we knew that we were dealing with a graft versus host disease.
one eye already melting, the other eye on the TABCL. And we had to go in for multiple surgeries for this, did a therapeutic keratoplasty, and finally had to go in for if I can just show the picture, that's just the last picture I have. And finally, we had to go in for a keratoprosthesis in one eye and the other eye a keratoplasty. There was a lot of waxing, waning. And this doctor, I would just, the last slide, I would just thank and acknowledge and say, and I would quote Dr. Isha, one of my colleagues who writes beautifully, by saying that blindness not only severely impacts a person's ability to function in their life, is also associated with many other secondary problems such as depression, falls, hip fractures, and isolation. For many people, fear of blindness is worse than fear of death. So it is not just important to treat the disease, but also important to sustain hope. Thank you so much for your time.
Thank you so much. So we move to the next presentation, will be by Dr. Sandra Filomentini. She's going to talk about the environmental and the lifestyle influences on ocular surface disease. Please.
Salam alaikum. Good morning, everyone. Thank you very much for the invite, for all the